I believe so. Yeah. So good afternoon, everyone. So today we have a 1 hour webinar starting at 2 o'clock. 5 minutes from now, we are going to talk about organ donation and transplants, the process and peer exchange program in Ontario today. So we will have 3 speakers. So stay tuned, and we will have representative from Canadian Blood Services and also Children's Gifts of Life Network to talk about how organ transplants works in Canada and also Ontario. So it will be very informative. And if you have any questions, please feel free to type it in the chat box anytime during the presentations. We will have a dedicated Q&A session at the very end. And one of our speakers are happy to answer your questions. And today's session will be recorded. It will be uploaded to our CRA Facebook later on. And you can always rewatch it or share with your friends or colleagues at a later time as well. And for today's sessions, we offer both English and Mandarin channel. So in the Zoom, you will notice you can pick either go like interpretation services. You can pick either English or Mandarin, and we have a professional interpreter today to do the live translation as well. And right now, if you're in the rooms, you should be able to see the screen, cover screen with the topics of today's topics, both in Chinese and English, and also the names and the titles of our speakers. Once again, today we offer live interpretations, both in English and also in Mandarin. So please make sure you pick the correct channel so you can hear it, the language that you prefer, and have a better understanding of the topics. And in the slide that we're going to show today, there will be some Chinese translation as well, and that will help some of our audience to understand as well. And if you just joined our webinar, just to remind everyone to mute your mic, because we want to minimize the noise and to allow the speaker to share the information easily. So we're about 2 o'clock. So before we start, once again, welcome to the webinar today. I'm Alan. I am the chair of the Chinese Renal Associations. We are going to talk about organ donations and transplant today, about the process and peer exchange program in Ontario and in Canada. We have 3 speakers today. it's going to last about an hour in total. If you have any questions for the speakers, please again feel free to type it in the chat box. They can answer your questions at the end of the presentations. And this will be a recorded event, and we will post it on the Facebook later on, and you can always watch it later on as well. Right now, we're still admitting some people, and I can see there are people coming in. Once it's settled down, we will begin the presentation. It's 2 o'clock. I think we can begin the officially we kick off the webinar today. So good afternoon, everyone. My name is Alan. I'm the chair of the Chinese Renal Associations chapters, part of the Kidney Foundations. Today we are very happy to have a webinar and 3 speakers from 2 different organizations. So today, once again, we are going to talk about the organ donations and transplants, the process and pair exchange programs in Ontario and Canada. We are very happy that we have 3 speakers. One of them is Sarah Perfung-Geek. She's a manager, program manager from organ and tissue donation and transplantations from Canadian Blood Services. And we have Kaylee and also Elizabeth from Children Gives of Life Network, part of the Ontario healthcare agencies that also focus on the transplantation and organ donation as well. So once again, today's session, it will be offered both in English and Mandarin language. If you prefer to hear Mandarin language, please feel free to change the channel. Look for the interpretations icon and you can change it to Mandarin. Today's session, it will be recorded, and once again, it will be uploaded to our Sari Facebook later on when it becomes available. During the webinar, we will kindly ask everyone, please mute your mic to minimize the noise and also the background noise for other audience. And if you have any questions, you can please feel free to type in the chat box. We have dedicated Q&A sessions at the very end. We are happy to answer some of your questions. Before I start, we would like to talk about one of our kidney donation peer support program with the Kidney Foundation of Canada, because sometimes we understand people may have a lot of questions about organ donations, especially living organ donations. If you have any questions, feel free to give us a call. The Kidney Foundations offer one-to-one peer support. We have trained living donors who can provide the support and also share the experience with you. So you have a much better understanding and to understand the program, peer support, transplant program from a living donor perspective as well. If you want to get more information, feel free to send an email to ontario.programs@kidney.ca, or you can call 1-866-340-7337. Once again, we have a peer support programs. Is in Chinese. The slides in Chinese. Is for anyone that, again, if you want support about, or if you have any questions about kidney transplantations, and you want to get more information, maybe from a patient perspective, feel free to call the peer support line at 1-866-390-7337. Also for kidney disease, for Kidney Foundation we have a website www.kidney.ca. You can find a lot of information about kidney disease on our website, including organ donation and organ transplantations. And just to talk about a bit of our Chinese Renal Association. So we founded in 1997. We are now part of the Kidney Foundation of Canada. We are all volunteers in Toronto who are committed to provide education, information, and support to the Chinese communities. And CRA includes doctors, nurses, social workers, dietitians, healthcare workers, patients, and caregivers. And in the past, we have hosted Kidney Awareness Day, Chinese New Year dinner, fundraising concerts, and other education workshops. And today, as I shared earlier, we have speakers from two organizations. The first one will be Canadian Blood Services. Sarah is one of the rep. So Canadian Blood Services is our Canada Lifeline. They are a national nonprofit organization that provides life-saving products and services in transfusions and transplantations for Canadian patients and to safeguard Canada's system of life essentials in bloods, plasma, stem cells, and organs and tissues. And they're the only government-funded organization that manufacture biological product. And the other organizations would be from Trillium Gifts of Life. We have Kaylee and also Elizabeth, two representatives. And Trillium Gifts of Life is now part of Ontario Health, a provincial healthcare agencies. They are responsible for delivering and coordinating organs and tissue donations and transplantation services in Ontario, as well as for planning, promoting, and supporting all healthcare and allied professionals, advocates, and the Ontario public in fulfilling their shared and integrated responsibilities in saving the lives of Ontario, waiting for life-saving transplants. So I will now pass it to our first speaker, Sarah, and I will stop sharing the screen. And Sarah, you can share your screen and begin your presentation.
So Alan, I think Kaylee is going to go first. Sorry, we're flipping the order on the slide.
No problem, no problem.
Okay.
Okay. Hi, everyone. I am just going to set up my slides here. Let's see. Where is my? Sorry, just 1 second here. Okay, so I've got my slides up. And for some reason, the presenter view is not working, but I will do my best here. So good afternoon, everyone. My name is Kaylee Faulkner, and I'm an educator at Trillium Gift of Life Network. I would like to start by saying how much I appreciate the opportunity to speak with all of you from the Chinese Renal Association. Thank you for inviting me to your webinar. Over the next 20 minutes, I will be providing you with a high-level overview of organ donation and transplantation process in Ontario. Following both Sarah and I's presentations, we will have a 20-minute time period to answer any questions that you may have. Feel free to put those in the chat or just bring them up at the end. Okay, so as an overview, during this presentation, I will present background information about Trillium Gift of Life Network and how we came to be Ontario's organ and tissue donation organization. I will outline our mandate, highlight the importance of donation, and identify the need for donated organs and tissues in Ontario. I will provide an overview of deceased donation, including logistics and how the organs are transported to the recipients. I will describe support and correspondence TGLN has with our donor families following the recovery of these organs and tissues. Okay, and again, we will have a 20-minute question and answer period. So a little bit of background about TGLN. The Trillium Gift of Life Network Act, which was established in 1990, led to the creation of TGLN by the Ontario government in December of the year 2000. TGLN is Ontario's central organ and tissue donation agency, legislated under the Gift of Life Act. This was formerly known as the Trillium Gift of Life Act Network. This act not only challenges us to improve donation across the province, but it also sets out requirements for many hospitals to call TGLN by law to ensure that all eligible families are offered the opportunity to honor their loved one's wish to donate tissues or organs at the end of life. The act also gives TGLN authority to collect personal health information and family contact information for the purposes of donation. Our mission at TGLN is to save and enhance more lives through the gift of organ and tissue donation and transplantation in Ontario. Our vision is that no Ontarian dies on the wait list due to the lack of an organ or tissue. So our mandate. TGLN's mandate consists of 4 broad areas of responsibility. The first is to plan, promote, coordinate, and support organ and tissue donation and transplantation in Ontario. We do this by working with healthcare and allied professionals, advocates, and the Ontario public in fulfilling their shared and integrated responsibilities in saving the lives of Ontarians waiting for a life-saving transplant. At TGLN, we conduct and contribute to research, develop and provide education, and work in partnership with hospitals, patients, and their families. Managing procurement, distributions, and delivery of organs and tissues, along with managing the waiting list to ensure fair allocation of organs and tissues, is a second area of responsibility in our mandate. Third is to raise awareness and to educate the public and broader healthcare community about donation and transplantation, for example, by doing sessions like these. Finally, we are responsible for collecting, analyzing, and publishing data and information related to organ and tissue donation in Ontario. So, this graph shows you the number of Ontarians on the wait list, transplants that have occurred, number of deceased donors and living donors, the deaths that occurred while waiting for an organ, and all over the past 10 years. The top blue line shows the number of people waiting for a life-saving organ. You can see this number has remained about 1,500 to 1,600. Currently, as of today, there's over 1,500 people waiting. The orange line shows the number of transplants that occurred. You can see there is a gap between the number of transplants and the people on the waiting list. Because of this gap, 141 people died last year waiting for a life-saving transplant. That's a lot of people. As you saw on the previous slide, despite progress being made, there are currently over 1,500 men, women, and children in Ontario waiting for a life-saving organ transplant. Some of you may be familiar with the Four Seasons Centre for Performing Art in Toronto. This is that big auditorium at the corner of Queen Street and University Avenue, if you're familiar with downtown Toronto. If you filled all the seats in this theater, it equates to the number of people on the wait list in Ontario. This is a lot of people. The number's big, but when you kind of put it into this visual scenario, it really kind of can blow you away how many people are waiting. Every 3 days, one of these people will die because they did not get their transplant in time. Donation and transplantation truly saves lives. One organ donor can save up to 8 people and enhance the lives of up to 75 more through tissue donation. So donation and end-of-life care. Not only does donation and transplantation save the lives of the recipients, as we just talked about, but it also helps donors and families. When polled, 93% of Ontarians support organ and tissue donation, and over 1/3, about 35% of eligible Ontarians have taken the time to register their consent decision. That's 4.4 million out of an eligible 12.6 million. Donation is an integral part of high-quality end-of-life care. In Ontario, this must include the opportunity to donate. For families that honor a loved one's wish, families know their loved ones best, it allows them to honor their registered consent decision or consent based on their loved one's values and their beliefs. By not offering families the opportunity to donate, we, as in healthcare professionals, are making a decision for them. So very important that if possible, if eligible, this opportunity is provided to everyone. In addition, repeated studies show that families are grateful when given the opportunity to donate organs and/or tissues, as it provides a source of comfort. Organ and tissue donation does not take anything away. It offers and allows something positive to come out of what is quite often an extremely difficult position. And actually, the reason why I got involved with Trillium Gifted Life was based on my experience as a registered nurse in the trauma and neurosurgery intensive care unit at St. Michael's Hospital, where I cared for many donors and their family. And I really saw firsthand how committed these families would become and how it gave them something positive out of an absolutely devastating experience. This diagram depicts the organs and tissues that can be recovered. When viewing this image, you can start to understand how one donor can save 8 lives and enhance the lives of up to 75 more. Organs that may be recovered include the heart, the lungs, liver, pancreas, your 2 kidneys, and the small intestines or the small bowel. Tissue includes eyes, heart valves, tendons, bones and musculoskeletal tissue, and skin. A recent opportunity includes recovery and transplantation of multiple tissues as a functional unit. This is called vascular composite allotransplantation. Examples can include an upper limb, so let's say a hand, an upper arm, a full face. We're doing thyroids, and this can be absolutely life-changing for the recipients. Of note is that the ability to be an organ donor is very rare. For organ donation to occur, generally patients are on a breathing machine, or many of you may have heard of a mechanical ventilator, and they need to be in a critical care area of a hospital or an intensive care unit, sometimes an emergency room. Also, patients eligible for medical assistance in dying may have the potential for organ donation, and we will discuss this in a further slide. Tissue donation can occur in conjunction with organ donation, or it can happen after death, apart from organ donation as well, exclusively by itself. So organ and tissue donation. Living donation occurs when a living person donates an organ or part of an organ for transplant to another person in need. For example, a kidney, or another example is a part of the liver. Living donors are most often family members or close friends of the recipient. Other types of living donation are available and include anonymous donation, list exchange, and paired exchange. My presentation, so this specific presentation, will focus on deceased donation. Many people believe that if you die at the scene of an accident or at home, it's possible to be an organ donor, but this is not the case. As mentioned previously, deceased organ donation is very rare, and only a very small percentage of deaths may lead to the ability to be a possible organ donor. You are far more likely to need to receive an organ transplant than to be a potential organ donor. And I think that's something that surprises many people. With the exception of a few special cases, as we talked about, a donor must die in a hospital setting on a breathing machine or a mechanical ventilator. Only about 1.5% of people who die in hospitals are eligible to be considered organ donors following neurological death or brain death, or an expected cardiac death in a controlled setting like an intensive care unit or an operating room. We will explore donation after neurological death, or NDD, along with donation after expected cardiac death, or DCD, in the following slides. Alice, can you go on mute, please? Thank you. Tissue donation can occur under more circumstances following death, and this has to do with how well the tissues do versus the organs without continuous blood supply. They also undergo a different processing process than the organs do. So recovery of tissue can happen after organ recovery, or again, exclusively even if organ recovery has not taken place. The pool of tissue donors is larger than organ donors just because they do better without that constant blood supply and because they're processing. TGLN is consistently exploring new ways to expand donation opportunities and believes all eligible Ontarians deserve to be offered the opportunity to be an organ and tissue donor. In 2016, donation was integrated as part of a quality end-of-life care for individuals receiving the provision of MAID, medical assistance in dying. Patients requesting MAID should be given the opportunity to incorporate donation into their end-of-life plans if they wish. This would happen after their decision to undergo MAID and after their approval. This respects the autonomy and the dignity of all patients who have the capacity to establish their own end-of-life care plans. So we're going to look at pathways to deceased donation. In general, there are two pathways to deceased donation. The first is donation after neurological determination of death, or NDD to simplify. As the images show, this means that there's no blood flow to the brain, although blood flow to other organs continues because the person is still connected to machines. When there's no blood flow to the brain dies. The person has died. The only reason why these other organs are continuing to receive blood flow in this situation is because the body is connected to machines and receiving continuous medication. So they've got an IV pump at the top of their bed hooked up to lots of medications with lines. They've got a machine hooked up that is forcing air in and out of them, but they are dead. Neurological death or brain death is determined using very comprehensive clinical testing criteria and sometimes neuroimaging if necessary. The second pathway that you see on the right-hand side of the slide is death by circulatory determination, or DCD. In this case, death is determined after planned discontinuation of life-sustaining therapy, when the person stops breathing and the heart stops beating. Blood flow to the brain and all other organs stops at approximately the same time. Just to give you an idea of numbers, in 2020, there was 218 donors, so organ donors, after NDD, neurological determination of death, so about 69%, and 96 deceased donors after DCD, about 31%. So the majority are donors after neurological determination of death. Okay. So pathways to deceased donation. We're going to look at these pathways in a little bit of a different flow. This slide provides a broad overview of the donation process for both NDD and DCD pathways to donation. The donation process for both NDD and DCD always starts when a healthcare professional calls us at TGLN and notifies us that a patient has met the criteria for donation. So we have comprehensive criteria for how somebody would meet the referral to call in. One of our coordinators will ask some preliminary screening questions and will look up if the patient is registered on the OHIP database. So if they've registered a consent for donation. If the person has sustained a catastrophic, irreversible brain injury and is completely dependent on a breathing machine and life-sustaining medications, 2 physicians will conduct that comprehensive brain death testing. If a person is dead, the healthcare team will tell the family based on what they found doing this testing. Only Only after this has occurred and the family understands that their loved one has died does TGLN talk to the family about donation. If the family consents to donation, therapy, so things like the breathing machine, the medications, are continued up until the point of the organ recovery. Moving to the right-hand column, you will see that the family and healthcare team have made a decision to discontinue life support because the patient has a non-recoverable injury that has resulted them requiring life-sustaining therapy and measures like the breathing machine and IV medications for blood pressure and heart rate. And their decision to withdraw these life-sustaining measures or life-sustaining therapy is made prior to any conversation about donation. So they make a consensual decision with the healthcare team to withdraw, that this person has such an extremely poor prognosis, they would not want to live this way. After that decision has been made, a coordinator from TGLN would then meet with them to provide them the opportunity to donate if possible. If consent is given for donation, life-sustaining therapy would be continued up until the time that the family and the healthcare team decide to turn off the medications, turn off the life-sustaining measures, and then organ recovery would take place after, always after death is determined by two physicians confirming the heart has stopped and the patient is not breathing. Organ allocation. Organ allocation refers to how it is determined which recipient gets a recovered organ. It does not matter if you are a celebrity. It does not matter if you know Justin Trudeau. It does not matter if you offer $1 million. Allocation is completed using provincial algorithms and it is anonymous. So information is entered into the algorithm, and this information includes the region for kidneys, the status of the recipient, so how sick is the recipient, their blood type, or you'll hear it referred to as ABO, the time the recipient has been waiting on the wait list, the size of the recipient. This is important to compare the size of the donor to the recipient to make sure that the organ will fit. This is especially important for organs such as lungs, as well as tissue compatibility, which is determined using a process called tissue typing. Information about organ allocation is public and can actually be found by anyone on the TGLN website. And at the end of this presentation, at the end of Sarah's presentation, I'm actually going to drop quite a few links that are publicly accessible into the chat in case you would like to look up any additional information, including on allocation. TGLN collaborates with organ procurement organizations across Canada and the United States to help with high status recipients. High status recipients are people who are extremely sick and will die shortly without a heart or liver transplant. High status recipients for kidneys include highly sensitized recipients who finding a match for them is very difficult. Recovery. Up to 4 different transplant programs offer organs for donation, recover organs for donation. Organs are often recovered by the respective transplant programs, although abdominal teams from London Health Science Centre or University Health Network may recover all abdominal organs for the transplant programs in Ontario. In the operating room, surgeons from the transplant program, TGLN coordinators, and the hospital operating room staff all collaborate to make sure that this recovery process moves smoothly. The recovery process looks similar to any other operation in the sense that sterile procedures are maintained and followed. The body is always treated with utmost respect and dignity, and the surgical incisions are closed following recovery. In fact, it may surprise you to know that if the family wishes, and if it was the wish of the donor to have an open casket funeral, in many cases, they can. A multi-organ case takes approximately 6 hours from beginning to closure, although can sometimes take a little bit longer than that. Transportation. Generally, the location of the donor is different than the location of the recipients. This means transportation of the transplant team as well as the organs must occur after recovery to get the organ to the hospital for the recipient surgery. After allocation has taken place and a recipient is identified, they are notified and prepared for surgery at their transplant hospital. Once the donor recovery takes place, the transplant team and TGLN coordinator package the organ. The organ is then transported with the transplant team to the recipient who is getting ready for their life-saving surgery. Mode of transportation differs depending on the location of the donor hospital and the recipient hospital. If both hospitals are within short driving distance, one or two of the TGLN vans and even a taxi may be used. To minimize time the organ spends out of the body, however, if the location is farther away, a plane is utilized for fast transportation. So some of you may look up into the sky when you're outside and see one of those orange planes. So that could be an example of how an organ is quickly transplanted if the hospitals are further away. Additionally, ambulances or police vehicles are often utilized to rush the returning transplant teams and organs from the airport or donor hospitals to the recipient hospital. So again, we want to minimize the time that the organ spends out of the body. So minimize that time between the donor and the recipient. Organ transplant, oh, where's my other image? There it is. Organ transplantation success and number of people who can be helped has increased with new technology and equipment developed to optimize the organ during transplant from the donor to the recipient surgery. The top left corner shows a machine developed for transportation of the heart. Once removed, the heart can be placed on this machine, which circulates blood through it, therefore keeping it pumping and perfused. On the top right, you will see the OrganOx liver machine. The liver can be placed on this machine, which circulates blood, medications, nutrients throughout it, therefore keeping it perfused and healthy during this transportation or the purpose of transplantation. The bottom left and middle picture show the kidney pump. Kidney pumps are used to perfuse kidneys with a preservative solution and keep them healthy for transplantation. Using the kidney pump, they can measure how much fluid flows through the kidney and the rate of that flow. So very high tech. The bottom right-hand picture of an organ being packed is in a cooler, a little bit lower tech. But yes, we do use your typical cooler to transplant organs in a safe and effective way. I'm sure none of you will ever look at your cooler sitting in your garage the same way again. Following up with the family of the donor, so this is after recovery has taken place, is very, very important. This is if they do wish to be contacted. They and their loved one have given a life-saving gift. TGLN connects with families multiple times after the recovery has occurred. A TGLN coordinator calls the family to let them know when the recovery has been completed, keep them up to date. The family also receives a sympathy card a few days later, followed by a letter a few weeks later, letting them know who the organs went to. In Canada, this is done anonymously. They would find out information such as one of your loved one's kidneys went to a 42-year-old woman and the other kidney went to a 34-year-old man. So there would be no names or identifying information. TGLN's Family Service Department provides a family aftercare program and acts as a liaison between the donor family and the recipient correspondence. This makes sure that anonymity is maintained. The Family Service team also organizes a reflection event to honor and recognize donors and their families, along with sending the family a Medal of Honor in recognition of the life-saving gift their loved one has given to others. As we near the end of my presentation, I would like to share two pieces of real correspondence with you. The letter on the left-hand side is from a child who received a kidney and their parent. It reads, "Thank you for my new kidney. I love it." His parent wrote, "Your magnanimous act means a lot to our child, and now he has a much improved and better lifestyle. our sincere and heartfelt gratitude. The paragraph on the right side of the slide is an excerpt from a letter that a mother of a donor wrote to the recipient. It reads, "As hard as it was to lose our son, the decision to donate his organs was easy. He saved the lives of 4 people and in essence continues to live on. We were and are proud of what he and we were able to do. Embrace your gift, and I encourage you to write a little note to their surviving family. Those letters help aid our healing, and we are thankful for them." So thank you for allowing me to be part of your webinar today, taking time on your Saturday afternoon to join us. I really do appreciate the opportunity to speak with you all. So again, after Sarah's presentation next, we will have a 20-minute question and answer period. And I will also be dropping in a few additional resources into the chat. And if you're not sure if you're registered to be a donor or you want to register, please take 2 minutes and visit our beadonor.ca to potentially save a life or more. Thank you so much.
Okay, thank you, Kaylee. That was wonderful.
You're welcome. Thank you for having me.
Alan, did you need to say anything? I was just going to share my screen.
Yeah, sure. Thank you, Kaylee. Yeah, we are going to pass it to Sarah and Elizabeth for the presentation from Canadian Blood Services. Thank you.
Perfect. So I'm going to ask Beth, can you see my screen?
Yep.
Okay, perfect. So good afternoon, everyone. My name is Sarah Parfnick, and I'm the manager for living donation and transplantation at Canadian Blood Services, and I oversee the kidney pair donation program. My colleague Beth Foreman and I are very excited to be here today and to have this opportunity to share information about living donation opportunities in Canada with your community. So most of us are born with 2 kidneys. However, a healthy person can live a normal, healthy life with just 1 kidney. This means that a healthy person can give or donate a kidney to someone whose kidneys aren't working. This gift is living kidney donation. There are 2 types of living donation: directed donation and non-directed donation. Directed donation is when the living kidney donor donates to someone they know. Non-directed donation is when the living kidney donor donates anonymously to anyone who needs a kidney transplant. They can donate to a waitlist recipient or through the kidney pair donation program. You will notice we refer to non-directed anonymous donors as NDADs. Now that we have introduced living donation, you might be asking yourself, who can be a living kidney donor? A living kidney donor is any adult over the age of 18 who is in good general health. Every potential donor must participate in thorough medical assessments and undergo many tests to ensure that they are healthy enough to donate one of their kidneys. In a healthy approved donor, the remaining kidney is able to compensate for the removed kidney by increasing its functioning capacity. Living donors are encouraged to visit their physicians for annual follow-ups to monitor their health.
What is the Kidney Pair Donation Program? The Kidney Pair Donation Program, also known as the KPD program, is a national program that matches transplant candidates with suitable living donors. It gives people the chance to become a living donor while ensuring that someone they want to help receives a needed kidney, even if they are not a direct match. Canada's KPD program is run by Canadian Blood Services, working closely with the living kidney donation and kidney transplant programs across the country. All provinces in Canada, including Quebec, participate in the KPD program. Next. There are many reasons why a potential recipient and their donor may want to enter the KPD program. The first reason why a donor may enter the KPD program is because they would like to donate anonymously. The KPD program gives non-directed anonymous donors, known as NDADs, the opportunity to donate a kidney to a recipient nationally. Another reason might be that they are compatible with their donor. However, they are looking for a better match, such as a better size match or age match. Finally, one of the most common reasons that a pair comes into KPD is because a potential donor may not be compatible with their intended recipient. Most of the reasons they are not a good match are medical reasons, and one of the most common is that they are not of the same blood type, otherwise known as incompatible. Next. You may be asking yourself, why would I want to or need to participate in KPD? Imagine you want to donate one of your kidneys to a family member or a friend who needs a transplant. However, medical tests show that you are not a good match for them. Another potential donor and their transplant candidate are in the same situation somewhere else in Canada. The KPD program can create an opportunity for pairs like these to swap donors so each recipient can receive a compatible kidney. To participate in the KPD program, you must be a part of a registered pair. Each transplant candidate must participate with an eligible living donor. The transplant candidate must meet medical requirements and be eligible for transplantation. This includes being in a state of good health as defined by their local transplant center. The living donor must meet the health criteria outlined in the kidney paired donation protocol for participating donors and complete medical testing to ensure they can safely donate one of their kidneys. This testing may take a significant amount of time to complete, and living donors are required to update some of the tests annually.
We are now going to dive a bit deeper into the kidney paired donation program. We want to highlight that participation in the KPD program is anonymous. Information about the transplant chains, such as the number of participants, location of the patients, and personal health information must remain confidential. Once a living donor is matched in KPD, their matched recipient and any information about the surgery or outcome cannot be shared. Without the altruism of living donors, the kidney pair donation program would not be possible. The KPD program and living donation and transplant coordinators across Canada work very hard to protect participants and their personal information. The allocation principles that guide the Canadian Kidney Pair Donation Program were developed by the Kidney Transplant Advisory Committee and the Living Donor Advisory Committee. The committee's clinicians help define the policies and procedures that the KPD program operates under. Some key guiding principles are to maximize transplants and work to propose the best possible matches for participants in the KPD registry, to minimize logistics where possible, for example, shipping the kidney where possible instead of the donor traveling. The matching system assigns points for the criteria that defines high need patients, and these points help to prioritize these patients. If there is a donor in our system that the high needs patients is compatible with, the system will make the match. Priority for higher quality matches means that the system is configured to consider all the blood and tissue typing between the living donor and transplant candidates and make the best possible matches. This is done to help minimize the chance that a transplant recipient's body might react to the new kidney and increases the chances of the new kidney functioning well. Evidence-based decision-making. All the decisions that affect how the KPD program operates and how the matching algorithm works is based on scientific information. Our KTAC and LDAC advisory committees includes physicians and specialists from across Canada. These clinicians provide guidance to keep our system operating with the best possible research, evidence, and leading practices. So now you may be asking yourself, how does the KPD program match incompatible pairs of living donors and transplant candidates across the country? The KPD program uses a computerized registry that has a special algorithm for matching donors and recipients. The registry is a computer program developed by Canadian Blood Services in partnership with our living kidney donation transplant programs across Canada. Living donation and transplant programs enter approved living donors and transplant candidate pairs into the registry. A pair is a donor and the transplant candidate they want to help get a kidney transplant, but with whom they are not a match. They also enroll non-directed anonymous donors, who are people that do not know anyone who needs a kidney transplant, but want to help as many people as possible to get a kidney transplant. Once all the information is entered into the CTR, the matching algorithm assigns points based on the participant's attributes. The system creates potential matches between transplant candidates and living donors who are active and ready to participate in a match cycle based on the points received for their attributes. The KPD team performs scheduled match cycles every 3 to 4 months or 3 times a year. When a match cycle is run, the KPD team runs the matching algorithm, and the system generates the unique matches that create the KPD chains. In between the main match cycles, the team will perform reruns. The system looks for opportunities for participants in chains that have collapsed and for participants who did not receive a match during the initial match cycle. If a chain collapses because the transplant candidate has become ill, or if a donor no longer can proceed with donation, the chain may qualify for a repair. It is not always possible to repair a chain, and in those cases, the participants are included in future reruns and in the next major match cycle. You may be asking yourself, how long will I have to wait to receive a match in KPD? Many factors affect the likelihood of receiving a match in KPD. As a registered pair, both the living donor and transplant candidate's individual matchability plays a role. The blood groups of both the transplant candidate and the living donor may affect matchability. Blood group O living donors increase the likelihood of receiving a match sooner because blood group O donors match to a larger number of participants in the KPD system. Sensitization of the transplant candidate can limit a pair's ability to match. Sensitization, which you might have heard of as CPRA, indicates the percentage of the population that a transplant candidate would likely react to, not be compatible with. It would be more difficult to find a suitable match for a candidate with a high CPRA. A CPRA, or calculated panel reactive antibodies test, shows how many antibodies a transplant candidate has and then calculates the percentage of the population that they would likely react to and reject the kidney. To find out more about your CPRA, please speak to your transplant center.
There are 3 different kinds of transplant chains that our matching system creates. We will show you those next. Before we discuss the KPD chains, we wanted to briefly review what a direct donation is. A direct donation is possible if you are compatible with your living donor. With direct donation, the donor is medically compatible with the recipient and can go ahead and donate a kidney directly to them. Direct donation is not a part of the KPD program. Unfortunately, donors are often incompatible or poorly compatible with their intended recipient. Direct donation in these cases may not be possible or the best option for the recipient. Next. One of the 3 chains in KPD is called a paired exchange. In a paired exchange, donor A wishes to donate a kidney to transplant candidate A, but they are not a match. Donor B would like to donate a kidney to transplant candidate B, but they are not a match. However, donor A is a match with transplant candidate B, and donor B is a match with transplant candidate A. In this exchange, the donors are swapped. The donor in pair B donates to transplant candidate A, and the donor in pair A donates to transplant candidate B. Even pairs that are compatible can enter into a paired exchange if their doctor feels that a better match donor will lead to a better transplant outcome. A compatible pair can also participate in KPD for altruistic reasons. A compatible pair can help create a transplant chain that includes incompatible pairs from across the country. A closed chain, similar to a paired exchange, includes 3 or more donor swaps. The donor of the last pair donates to the transplant candidate of the first pair. In KPD, these chains may include up to 6 pairs. In this example, donors are exchanged between 3 pairs, but there is no limit to the number of pairs that can participate in a chain. Approximately 40% of KPD transplants are through paired exchanges and closed chains. The last chain, called a domino, begins with a non-directed anonymous donor, NDAD, who donates to the transplant candidate of a registered pair. There can be multiple registered pairs in a domino exchange, as you can see with pairs A and B here. The exchange is complete when the donor of the last registered pair donates to a transplant candidate on the transplant waitlist. Domino chains are possible when someone volunteers to donate a kidney anonymously to a stranger. These donors, called non-directed anonymous donors, can initiate a chain that helps multiple patients get a kidney transplant. You'll see an image of what this looks like on the next slide. The NDAD donates to the transplant candidate of a registered pair, with the donor from that pair making a donation to another recipient, and so on. That exchange is completed when the donor of the last registered pair donates to a transplant candidate on a provincial waitlist. This generous act of giving by non-directed anonymous donors has meant that as of May 7th, 2021, 504 of the 798 total kidney pair donation transplants have been made through Domino exchanges.
As the onset of COVID-19 cases impacted hospitals, the Living Donation and Transplant Program suspended activity beginning in March of 2020. We have come a long way since March of 2020. As waves of the pandemic affected provinces and cities differently across Canada, the KPD program worked individually with each program to determine when they would be ready to return to transplant activity. The effect of COVID-19 was significant and produced an overall reduction in kidney transplant by 20%. Deceased donation decreased by 12%, and living donor transplant, which includes KPD, decreased by 35%. The map shows how the pandemic affected transplant activities differently across the provinces. As we are now into a third phase of the pandemic, COVID-19 will continue to affect transplant activities in Canada. The KPD program will continue to work with our living donation and transplant programs across Canada. If you are interested in learning more, please visit our website, blood.ca/organs and tissues. Beth is going to put this link into the chat once we're done the presentation. And we do have brochures available in 11 different languages. And from on behalf of both Beth and I, Canadian Blood Services, and the Kidney Pair Donation Program, we would just like to thank you for allowing us to come and to present to your community and to help everybody learn a little bit more about the Kidney Pair Donation Program. So thank you.
Well, thank you, Sarah. Yeah, and thank you, Beth. It was an excellent presentations, and Kaylee as well. I think this is very alarming to see that how COVID-19 has also had a huge impact on our transplant, and we definitely need to see more, encourage more people to come out and also sign up to be a donor, because it can happen on anyone's. And in fact, I know kidney transplant is one of the most popular transplant in Ontario. A lot of the people with kidney disease, in fact, they have to wait until they get a new kidney in order to be to have a much better quality of life, or else they have to stay on the hemodialysis programs or pure dialysis program as well. I understand there's some question that's sent in advance. Maybe I'll let the speaker to begin answer some of the questions that we got earlier.
Sure. I do see a few questions in the chat. Maybe I can answer, they're both to me, so maybe I'll do answer to those two, if you don't mind, in the chat, and then we can go to the questions that were sent ahead of time. Okay, so the question from Sam is, can people with chronic diseases like diabetes, heart disease, or kidney disease be organ donors? And the answer to that is, in general, yes. So none of the chronic diseases that were listed are absolute exclusion criteria. Something like HIV would, or certain types of cancer, would immediately shut down the opportunity to be a donor. But for example, even if somebody has diabetes there will always be testing, individual testing done on not only the general health and the kind of full health status of a potential donor, but also organ-specific testing. Examples of some organ-specific testing: if the heart was being considered, they could do a cardiac angiogram. They would also do some blood work to look for the health of the heart through enzyme markers in the blood work. They would do an echocardiogram. So depending on the person, even if they have a chronic disease like kidney disease, they can absolutely still be a donor. And maybe if it's not for one organ, there may be another organ that will absolutely be functional and will save somebody's life. So patient specific, but yes, people with chronic diseases can still be donors. The second question is there an age limit for organ donation? So yes, but it is organ specific. For example, right now to be considered for cardiac donation, so for heart donation, the potential donor would need to be over the age of 36 weeks, corrected gestational age, up into about 70, it used to be less than 70. Every organ is different, and sometimes these age criteria do change. So age was definitely considered based on what we know about the organ and how well the transplantation does from different ages. There's an example, so 80 plus, can they be a tissue donor? An 80-year-old or higher would probably not be deemed, like maybe on a rare basis, they may have an organ that could be donated, but typically no for organ donation. But yes, we have actually had donors for tissue that are in their 90s. Sometimes they cannot be for transplantation, but something that is so important is sometimes people consent for research and education. And what that means is it does not go to first-year anatomy classes. It does not go out into, a general high school biology lab. When somebody consents to research and teaching, so let's say they're kind of past that, the age criteria for a certain organ or tissue, it helps with training the recovery coordinators as well as research for transplant programs. And so even if somebody doesn't meet the criteria, whether it's because of a chronic disease for a certain organ or a tissue, many times they can help assist organ and tissue donation and transplantation and research by consenting to that as well.
Okay, thank you, Kaylee. We have about 3 minutes left. We have to we have a hard stop at 3 o'clock. Maybe we'll pick one more question that we got earlier, and maybe I'll let Sarah to pick one question that you may have received earlier. You're mute.
I'm on mute. I'm just taking a quick peek at the questions. Kaylee, do you want to tackle number 2 because it kind of talks about living and deceased?
Okay, so the question that was sent to us is, if a patient's living donor is not compatible, does one automatically go onto the deceased donor list? If so, how far along the list would you be placed? Or in this case, will you still be listed on the day you started dialysis? So once a recipient is deemed eligible for a kidney transplant, they can pursue living donor kidney transplant or keyword and, be placed on the waiting list to receive a deceased donor kidney. The question about the timing with the start of dialysis, yes, the date the person started dialysis is the day they are listed and on the wait list. The recipient's wait list is calculated based on this date, and I've actually included a link that will show you just a one-pager of how wait lists are approximate wait times based on somebody's situation, which is a link in the chat box. So if the recipient chooses to pursue finding a living donor, this is done while the recipient is on the wait list, not always, but in most instances. If a potential living donor is assessed and deemed ineligible for their intended recipient, they can explore kidney paired donation and list exchange as further options. So what Sarah and Elizabeth were just speaking to. So as a bit of a recap, the National Kidney Paired Donation Program is this interprovincial organ sharing program operated by our presenters here, Sarah and Elizabeth, with the Canadian Blood Services in collaboration with Canada's Living Kidney Donation and Kidney Transplant programs. This program gives individuals an opportunity to become living donors and donate a kidney to someone in need, as you heard about, and in doing so, provide transplant candidates an increased opportunity to receive a transplant.
Thank you, Kaylee. So it actually comes to 3 o'clock, also the end of the presentation. And I once again, on behalf of Kidney Foundation and Sarah, I would like to thank Sarah, Elizabeth, and also Kaylee for your time today. It's really interesting, and I think it's an important topics for everyone in Ontario and in Canada to understand more about organ donations and to learn more and share more about this important news. And also thank you everyone for attending today's sessions, and that's also the end of today's session as well. Thank you and have a good weekend.
Thank
Bye.
you.
Thanks.
Bye.
Everyone.
Bye.
Thank you.